clinical rotations, provide mentorship for foreign medical graduates, and help them in providing U.S. experience as an observership. Research experience work on effectiveness of cryotherapy on small skin lesions like general warts, actinic keratinosis, etc. Licensors, he is a full MD license in the state of Illinois, unrestricted Federal Drug Administration license of USA. Education, he has a fellowship in geriatrics from Metro Health Medical Center in Cleveland, Ohio. Certifications, he is American Board Family Medicine geriatrician, and also ECFMG certified. Community services, charity clinic, board of director at Hayat Clinic, working in a not-for-profit charitable clinic in Chicago. This clinic is run by doctors who are willing to provide free medical care for the needy persons who cannot afford to have insurance. In Hurricane Katrina, he was selected as one of the 4 residents to help provide affected from the hurricane in New Orleans. His interests are table tennis, lawn tennis, and swimming. So with this humble bio, I would like to request Dr. Farooq Ahmed to take over this. Thank you.
Assalamu alaikum, جزاك الله.
Thank you, Brother Akhtar, for your information given to us. And as you know, in this committee, we have presented in the previous all informative lectures. Among all, this lecture will be very informative, as well as it is very useful for all of us. So without taking any time, I will request Dr. Farooq to present.
جزاك الله خير brother Amjad. Assalamu alaikum warahmatullahi wabarakatuh. That was a detailed bio for me, brother Sadiq has told about. Jazakallah khair. And first of all, Dr. Khalil Sahab has recited a very beautiful verses from the Holy Quran, and one of them I remember is Rabbir Hamuma Kama Rabbayani Saghira. And I take a little pause just for 1 second because my mom just walked in and I want to say salam to her. Assalamu alaikum. That's my mom there. She just walked in, so I'm just taking a little respect from that ayat. Alhamdulillah. So let me start with thank you so much, Jazakallah khair, for the senior committee, Brother Amdar Hashmi, Brother Akhtar Sadiq, and the whole senior committee. Jazakallah khair for inviting me. Like Brother Hashmi said, I'm not a guest, I'm still a part of the community. I've been living in Morton for almost about 20 years, I would say. My kids, 4 children going to MCC school, 1 just graduated last year, and 3 are still here. I'm pretty much part and parcel of this MCC MEC committee. Community, alhamdulillah. So this is a very important topic, like Brother Akhtar has said. Very less, it's really very relevant to the community here. Yes, I think it's much better now. So this aging and dementia most of the time goes hand in glove together. As everybody progresses to the age, elderly, they get more and more older. Some of them, not everybody, but some of them, most of them, I would say about 55 to 60% of the people, they start getting some memory problems, memory loss. So this is very important topic. Before we go to that point of having a memory loss or dementia, we got to do certain things to prolong the onset of the disease. We cannot stop it. We cannot cure it. There's no cure for that. There is no treatment for that. As of now, there's some medicines coming up, very promising medicines coming up starting this year. They might be, the FDA just approved 1 drug, but still is not promising yet to cure the disease. So the focus for this point is to how do we prolong the onset of the dementia so that we can have a quality of life. That's very, very important. Quality of life matters a lot. Let's say if somebody is getting dementia at the age of 72 or 70, that's pretty much common age. And if you prolong the onset of dementia from 70
to 78, 76, at least 5 to 6 hours, we can buy some time. This very quality of time. This matters a lot to everybody here. So let me get started with the program here, alhamdulillah. I'm going to divide this program into 3 sessions. First one is going to be, I'm going to define dementia, what is memory loss, dementia, their causes, and their medications, how to treat, what not to do, what the doctors do to diagnose this dementia. Then next was going to be treatment. Second session was going to be the non-medical things. That's where the crux of this program, the main focus for this program would be, what can we do to prolong the onset of diseases? That's the second part. And the third part is going to be a Q&A session for another few more minutes. But more than welcome, anybody can ask me any questions in between. I try not to forget things here. If you ask any questions in between, more than welcome. I'll be happy to answer the questions. So let's get started. The topics define dementia as defined, the causes, what are the stages of dementia, what brain can do, what does it do, and how do we reduce the risk of onset of this dementia, what can we do, the strategies to manage those things. So what is dementia? Just to define, it's a group of symptoms that involve declining in cognitive functioning, behavior changes, and that affects everybody's activities of daily life. So what the brain does to us, what we have in a normal brain. The normal brain stores our memory. It helps us with learning language and expressing the language. It helps with the vision and hearing. It perceives the inputs from the surroundings, from the people around us. And it also helps with motor skills like walking, driving, those kind of things. And also reasoning, logistic reasoning, to do a national really logic reason for anything. Then also help you with the judgment, take a proper judgment, abstract thinking, and attention. So dementia, coming to the dementia properly, this memory loss. There are different types of dementia, about 4 to 5 types of dementia. Majority of the dementia is Alzheimer's dementia, that probably most of you might have heard about it, and they might be hearing from the doctors or from the community. It is about 55 to 70% of total dementia is Alzheimer's dementia, where it causes, there's an accumulation of plaques called amyloid plaques in the brain that affects the memory loss. And there's another, next one is vascular dementia. What is vascular dementia is because of somebody has diabetes, uncontrolled diabetes especially, uncontrolled blood pressure, or somebody has a stroke. Those causes a blockage in the brain circulation. That causes dementia or memory loss also. Rest of them are other 3 more causes. That's not a whole lot. Maybe about the rest of the 3 causes constitutes about 10 to 15% of the rest of the dementia. So I'm not going to go detail into that one. So main thing is this really a dementia? Is this really a memory loss or something else? There are certain things that can mimic as memory loss, but it's not a memory loss. So how do we define? Those things are temporarily transient. It's not permanent. Once you remove that barrier, memory comes back to normal. So that's called pseudo-dementia. It's not. There are certain causes for pseudo-dementia. It's called depression or delirium. Let's say somebody is depressed, and they tend to stay at one place. They try not to mingle with anybody, social isolation. In the meantime, they end up forgetting things. But once you treat those depression or delirium, the things come back to normal. So before somebody diagnose a doctor or a neurological doctor can diagnose them as a dementic, we got to rule out all these causes first before we tell them that this person has dementia. There are certain reactions to medications. Certain medications, something that's newly introduced to anybody and causing the loss of memory, definitely talk to your doctor. Hey doctor, this is something new medication and my parents or family member is experiencing some forgetfulness. Can you check into that one? This medication can cause memory loss. That can be reversible also. There are certain metabolic imbalance like dehydration, electrolyte imbalance, potassium, sodium, low potassium or low sodium in the body that can also cause memory loss. That's transient. It's very temporarily that can be reversed and come back to normal. And there are certain vitamin deficiency. I'm going to come back to this later. There are certain vitamins that are really, really important that can permanently cause dementia. So I'm going to come back to this later on. Vision loss and hearing loss is also one of the important cause in the senior people that can mimic as dementia. Person might not be hearing properly or not be seeing properly. They try to avoid people getting connected with them. So they try not to mingle with people because I'm not hearing properly. I cannot hear what he's saying properly to me. So I feel a little ashamed. I feel a little embarrassed to go in and talk to them. In the way people think that I'm getting dementia, that's why I'm not going together or not involving myself into the activities. So that's one cause. Emotional distress and chronic pain are also one of the causes for having pseudo-dementia. So since we're talking about dementia, Alzheimer's dementia is a majority of the dementia is Alzheimer's dementia. It's about 60 to 70% of total dementia is Alzheimer's dementia. So I'm going to give you some points about Alzheimer's dementia. It's very small letters here. So first of all is memory loss that disturbs the daily life. That means person would not be participating in any social activities, not going to the places where he always goes, enjoy the activities, that withdrawal from those normal activities. Then challenges, they face challenges in planning and solving problem. Planning in the sense, I cannot do my finances properly. I used to go to the bank properly every day, every week, or once a month, but I cannot do it no more. I cannot maintain my checkbook, or I cannot do other normal activities that I used to do, but I cannot do it no more. Then sometimes they get confusion to time and place. I get lost. I'm going to the every day or every week, regularly I go to certain places, I got lost. That's my normal routine places. I start losing the track of coming back my home. So that's also one of the causes of Alzheimer's dementia. And new problems with words or speaking or writing. So learning capacity or capability is one of the dementia's characteristics, is they lose those those things. Misplacing things and losing the ability to retrace back. Right. So I put something else, something at a certain place. I can remember where I put it back. After a few minutes, even if I forget those things where I put it, I had it so close that I don't remember certain things. But after a few minutes, I can trace it back to where I put it back. But with this dementia, that does not happen that way. And in that way, people end up having paranoid behavior, like suspicious behavior. They start accusing somebody, you steal my thing. I was just right here a few minutes ago. Just yesterday I put it here, but I hide it somewhere else. So they get a little suspicious behavior that comes up too. So decreased judgment and poor judgment, they cannot decide, they cannot take their proper judgments, and that ends up lead to withdrawal from the social activities. And that can further lead to irritability, mood swings, and personality changes. Any questions so far? Yes, please.
Can you categorize it to mild, moderate, severe?
Coming up, you're there. You're reading my mind, I know. Mashallah. I'm coming there. So testing for dementia. So medical examiner like doctors, geriatrician, neurological doctors, and primary care doctors, they can do a lot of testing to see is it really a dementia or something else, like a pseudo-dementia. It's a battery of testing, lasts about 45 minutes to test those things, to truly figure out which one is which. And what we do is we assess the functioning of behavioral changes. We'll check for impaired memory or thinking skills, changes in personality, mood. We interview with the family member. These are the very, very important thing for a family member to come in. Whenever somebody is going for a dementia evaluation, it's very, very important family members goes with them, because they are the very important clue to us. The initial stage is very important. The initial stage is very, very important here in dementia, in memory loss. So, and I would be in denial at the start with. If somebody is getting a dementia early onset, I would be in denial. I would not accept that I have dementia. But family member gives me the clues. So I'm going to come back to that one again one more time. The family members are very important when we go for the testing. Medical test, blood test, brain imaging like MRI, those are the things. And there are certain cognitive testing that we do, like a mini-cog, Montreal cognitive assessment, and mini mental assessment, or St. Louis examination testing. So these are the things. Right, now there are the stages of dementia. Before we go there, I would like to take a small little break, and there are some papers on the table. I put it around. Don't put your name on that one. So let's do a little exercise, interactive program. Is that okay? Everybody is okay? Nothing wrong, nothing loose. It's just a small thing that I would like to do. It's a small circle, and some rectangulars there, crossing rectangular there. So if there are 3-4 papers on the table, Do not write your name or anything, just draw on the circle. On the circle, we know everybody what the clock looks like, right? It's a round clock. So I would like you to put the numbers on the clock, like 1 to 12 numbers, and draw the time with the hands on the clock by 2:30, time 2:30. So draw the numbers on the clock, what does the clock looks like, and write the time with the hands of the clock, draw the hands of the clock with the time 2:30. You're not, sorry? Pens, oh, sorry, senior committee. I should have told him that. You forgot, I forgot, there you go. I know. I should get tested for that too, right? While some are doing that, let me keep on talking some other things. Yeah, draw the hands of the clock with the time 2:30. Yeah, mashallah, teamwork here, mashallah, it's very good, mashallah, everybody's helping each other. And if that's done, next bottom is a rectangular crossing each other. I would like to copy the design. Don't forget about the angles, numbers, those kind of things, don't worry about that. Just copy the design right at the bottom of the page. There's a copy design, rectangular, two rectangles, right? So those two slides, just draw as much as possible, as close as possible. Try to copy the design. What's going on?
This is good for you.
Good for me? What is it? Oh, this one. Okay.
2:30 बनाएंगे 6-10 मिनट.
6-10 minutes. Yeah, there's nothing right or wrong. Just do this thing and write the numbers on the clock. That's more important is 1 to 12. 1 to 12. Write down the numbers on the clock too. Everybody enjoy doing that? Yeah, you can take it. So I'll collect those papers later on. So this is the exercise that when we go to the doctor's office, this is only 2 questions. But the doctor is going to ask you about tons of questions, about 8-10 pages of questions are there. So those are the skills we have here that we just gone through that one. Like Allen cognitive levels, mini mental examination, slums, St. Louis examination. So I'll take it. MashaAllah, very good. MashaAllah, perfect memory, MashaAllah, looks like that. MashaAllah, everybody's good. Alhamdulillah. MashaAllah, very good. So, shall we move forward or still working on that? So for keep us moving with the time, keeping time constants in mind. The stages of dementia, like Brother Mansoor has been asking about the dementia. They're the stages of dementia. This testing would define where am I, where a person is, where a patient is. Is it mild, moderate, or severe, or end-stage dementia? There are 4 stages of dementia. Mild, that's very early onset, moderate, medium size, or late onset. And the 4th one is end-stage dementia. So there are 4 stages of dementia there. What are the things that early or mild stage of dementia? Usually they're pretty much independent, still doing their activities, going to the namaz, mashallah, going to the bank, getting the money for their wives, for sure. I know. And doing all the activities, they've been doing it independently, driving, not getting lost back home. Everything was independent. There are small lapses. This is the buzzwords that we really need the family members to notice about this. They cannot, there are word retrieval issue. They cannot forget the naming of the objects. Let's say sometimes I forget what is this. Everybody knows this is what is this. But people they might not able to name this object. That's what it is. And that's why the family member notice it. They know what it is, but they cannot express it. And the family member comes and tells you, Dr. Sahab, ये बोल नहीं सक रहे, कभी-कभी भूल जा रहे इसमें बोलने के वास्ते. So those are the buzzwords, very, very important signs. The family member notices this one. I would not accept that I forget this name. I know what is pain, I know what it is, but I would forget that one. I would not be able to tell you. So may have trouble at work or with planning or organizing. Symptoms not widely apparent. Like I said, the family members notice most of the change. Sometimes they get very irritable. Small things, I get very jittery. I start screaming or I start doing some things. I feel very uncomfortable at the home, even though it's pretty much normal thing. But that person start feeling very irritable. So, and also depression also is one of the things. So this is very important. The family member, this should really, I'm going to come back to this again for the early stage of dementia. This is where I'm going to focus at the end where we're talking, where the crux of the talk is. So mile is very, very important. Keep in mind, family, I really need the family's input for taking care of this patient at this point. So I'm going to come back to this again later on. Moderate stage, the things are getting advanced now. Things are getting towards the downside now. So what happens is people get more aggressive, more anger, small things without any simple provoke, they get very angry. Things not getting in properly, I get angry and I get very irritable. That's one thing. And they more increase forgetfulness, they get more confused. They get, this is the time people would forget to come back to home. They go to the normal activities, normal regular places, but they forget to come back to the home. Somebody has to bring back to the home. And the general emotional distress, loss of social filters, they don't know what they're talking about. It's not in their heart and mind, it just comes out. They don't know what they're talking about. Some irrelevant things. Physical or verbal outburst. Like I said, they get very irritable, very jittery. Small things, not even small things, just normal normal settings can provoke them to get irritable. And sometimes they get hallucinations, sometimes they get paranoia, like suspicious activities like I told you about. They forget things, they know what the things are, they start accusing people, you're stealing my things, you're stealing my money, I just left the money under my pillow here, it's not there no more, but I'm hiding it somewhere else, I forgot that. Right. Hallucinations, sleep issues also, sleep issues and sundowning is also one of the major things that really have to be addressed at the same time when we come to the moderate dementia. And this stage lasts for 6 to 8 years. Mild dementia, mild memory loss lasts about 4 to 5 years before it goes to the moderate. Then after the moderate 6 to 8 years, then if you don't treat those things, or if you don't give some medications or therapy, there will be sudden nosedive to go down to third stage within 2 years span. People can go down nosedive. That's that's called late onset or late stage or advanced dementia. It's a few months to a year, just 1 year, 2 years at the most, or 3 years at the most. And in there, they lose ability to respond to the environment. They try to confine themselves to this one just small place, sitting in the bed, not really doing any activity. Family has to bring the food to them. Those are the things. Very great difficulty in communicating with the immediate family members or outside any other members. They just communicate through their behaviors, and they have difficulty walking, sitting, or sometimes they have problems swallowing too. They get, like we have a hadith, as we grow older, we tend to go back to our early stages. They tend to forget to swallow, and that can cause aspiration, pneumonia, those kind of things. That happens at the very end stage. And at this stage usually requires almost 24/7 care. If not 24/7, at least about good amount of day they need to be watched carefully. Next stage is end stage dementia. They are pretty much bed bound, chair bound. They're pretty much dependent on everything. They need help for every single thing they need help. So eating, feeding, changing diapers, they get a little babyish. That's why the life get reversed now. This is what our belief is. So they keep on doing repetitive behavior, just requires 24/7 care. Sometimes people end up getting in hospice care too. So now next slide would be, what does a normal brain looks like? Lobes of the brain. It's very foggy, right? I can't see it properly. It's frontal lobe, parietal lobe, occipital lobe tells you about your vision, frontal lobe about your mood disorders, those kind of things. Parietal lobe, temporal lobe is hearing. There are different functions. Each lobe has a different function. But dementia people get very foggy. The good, like the real brain, the memory brain is, next slide is, the fresh brain is this. There you go, see, he is very active, mashallah. So these are our lobes, right? I know, biryani, chai, halim, those kind of we want it. That's good memory we have. So just a small, making you interact again. So next, we go to next is, what does it, the dementia causes? It loses motor skills, lose fine dexterity, using the utensils, writing, pens, small, finer things will be gone at this time. And largely they lose their balance, coordination, gait imbalance, falls problem, risk of having fracture because of falls. And they lose their reasoning and judgment. They cannot decide, take any decisions properly, concrete decisions. They start getting a little more hallucinating, and they lose the abstract thinking. Higher level of thinking is going to get lost. They cannot pay attention properly. They cannot focus to a certain topics, important topics properly. They keep on wandering to different place, one place to another topic. And what does this left side of the hemisphere, what does it do? It is vocabulary is lost, comprehension is lost, speech is lost. In early dementia, unable to comprehend 4 words. Then they tend to lose their nouns, may revert to native language. Because in Alzheimer's dementia, especially in Alzheimer's dementia, the recent memory is lost. The remote memory, the past memory, childhood memory get retained. We retain the childhood memory. That's why we go back to if somebody having a bilingual or multilingual, they go back to their native language. They tend to forget the recent memory, and that ends up in social isolation. The right side of memory, we get social chit-chat, rhythm, music, poetry. That's nice. Okay, coming back to the treatment-wise, there are a lot of medications that's been going on for several years now, from mild to moderate, moderate to severe, severe to end-stage dementia. The end-stage dementia, we cannot do much about it. There are not many medications for that either. So most of might have heard about Aricept or Donepezil, for usually use it for mild dementia, early stage dementia. We can go for Namenda or Memantine, or somebody if they cannot tolerate any oral medications, there's a patch called Exelon patch that can be done too. And the newer medication, like I told you about earlier, there are promising medicines coming up for Alzheimer's dementia. That's called aducanumab and lecanemab. So that's different tongue twisters there. So these are the infusion IV therapy. So it's not an oral pill. So it has to go to the doctor on a regular basis, get those IV therapy done. And the promising thing about is the plaques formation in the brain, that's called amyloid plaques. These medicines decreases the formation of those plaques. So that's very, very important for Alzheimer's disease. So this is the very strong theory. It's not concrete thing either, but still these are really concrete, strong indications that these amyloid plaques are the causes for Alzheimer's dementia. So these medicines are really promising coming up, hopefully by next year, end of this year or next year. These medicines are almost approved by FDA. They should be coming up in the market soon. So that's very good, promising things coming up soon. But it's very, very, very expensive. $56,000 per year. I'll tell you this. It's very expensive. Hopefully the insurance, most of the insurance should pick up slowly down the road. Now the third part is non-drug treatments. What can we do to prolong the onset of the disease? We cannot cure it. There's no treatment for that unless new things comes up. But what can we do now? This is the crux of the talk. We're doing it today. So non-drug management. So are we ready to go? Start? Keep going, or we'll take a break? Or? Okay. So main thing is sleeping, going to bed. Meals are the most important ones. Sunlight exposure is one of the main thing. Everybody needs it. Healthy, non-healthy, everybody needs it. That's one of the important gift of nature we have. So go out early in the morning, take a walk. And recently the senior committee has started in the summer senior walk in the afternoon. That's a very good thing, mashallah. So keep doing it, and I wish you can add some more things to that one. I'll be happy to help you with that. Encourage daily exercise. That's one of the important things. Daily exercise, at least 4 times a week, 15 to 20 minutes. Stretching exercise, small weight bearing exercise. This is one of the important thing that we really need to have it. That really helps keep us focused, prevents falls, helps us active, and also helps you with avoiding or prolonging the onset of dementia. Avoid alcohol, we don't have it. Avoid caffeine and nicotine as much as possible. And pain, treat the pain. Pain is also one of the cause to have a memory loss. People having severe pain does not get treated properly. They tend to withdraw from the social activities or social life, and that end up causing dementia. Any questions, any other questions in the meantime? No. So certain drugs, if a person is taking certain drugs like Donepezil or Aricept or the Exelon patch or other things, try not to give it before bedtime. And make sure the bedroom temperature is very comfortable. And sorry.
So going back to that alcohol and caffeine you put in the same line.
Right, I should take it out. This doesn't apply here. I was just giving talk to some other normal, regular community. So yeah, I should take it out. Sorry about that. So avoid late night sleeping. Try to use the bed is only for sleep. If I get up in the middle of the night or going to the bathroom and I cannot sleep, come out of the room for a few minutes, then go back, try to sleep. Try to turn off the TV. Try not to watch TV while sitting on the bed. Try not to read any books while going to the bed. Bed is only for sleep. So if anything happens that I cannot sleep properly, come out of the room, try to distract yourself. And like I said, that one, yeah. Discourage watching TVs during the period of wakefulness. And the risk reduction strategies. This is also one of the important slides where we have, focusing today's topic. What's good for the heart is good for the brain. Healthy habits keep us clean. So eat a balanced diet, especially avoid carbohydrates, cereals, sugar, those kind. I'm going to come back again to that one too. So control your blood pressure, like I said, the blood pressure, diabetes, try to control it at the early onset. If I have a uncontrolled blood pressure and diabetes throughout my life, now I'm turning 60, 65, I'm trying to control it, but the damage has already been done. It's not reversible. So try to control the diabetes, especially and the blood pressure at the early onset. When we try to start. The longer the disease that we have in the body and the most uncontrolled we have in the body, that's where the people will going to get most in the hard water down the road. Right. So get regular exercise, at least 150 minutes per week. That's about 15 to 20 minutes every day. Do not smoke. Establish healthy habits, vaccines, manage stress, stay socially connected. This is also one of the important things. Stay socially connected. Have friends. Involve in the community. Involve in the committees and the community also. Have more social friends. Have more social activities. Go to the parties if you have anything. So involve yourself because the research has said that people who are involved in social activities, they will be delayed in the onset of dementia, memory loss. There you go. Table tennis, whatever we have in here, mashallah, MCC, MEC has a bunch of activities going on. Most of us don't know every single day something or the other is happening. And we just need to know about what's happening. Right? Engage in activities that challenge your brain. I'm going to come back to that again too. And what do we know about healthy aging? Eat less sugar. I told you about cereals or any other sugar items that has linked to the health issues and chronic disease, that including the cognitive decline. Try to avoid as much as sugar as possible. So simple carbohydrates, avoid that. And the fish supplements is also very important. Fish oil or eating fish, those are one of the important things. Not only for the brain, it's healthy for the heart too, and also it helps you with the cholesterol, build up good cholesterol. Make time for meditations. Always, this is one of the good slides. Challenge the brain. Mashallah, everybody recite Qurans and everything on a daily basis, regular basis. Doing the regular activities is good. I'm not denying that one. Reading books, doing crosswords puzzles, or reading recitation Quran and everything. Main thing is challenge your brain. That's what the brain exercise is. I'm doing some exercise. Just simple exercise is not going to pump up my muscle. I have to do some vigorous exercise, right? So challenge your brain. Involve into the tafsir of the Quran or hadith. Challenge yourself to do something extra. Not just reading the books or just regular recitation is definitely going to be helpful. I'm not saying that there's no beneficial to that, but to challenge your brain so that brain can get more exercise that can help us prevent the onset of this memory loss. Train your brain and use some games that challenge your brain. And like I said, Quran recitation, memorization is also one of the things. I know two community members here. One of mine is a teacher, Dr. Abdul Sattar. He started memorizing Quran after the age of 60, mashallah. He's Hafiz of Quran now, mashallah. And another brother, our Muazzin, Brother Patel, right? He's also started memorizing Quran. So never too late. take a step, take the initiative. Don't feel shy, oh, it's too late for me. It's never too late. Every day, whenever rises, the sun rises. That's more important. Maintain moderate weight. Several studies has shown that obese or overweight is a risk factor for cognitive decline. Get enough sleep, that's one of the important things. Especially if I'm not getting a sleep during the night, take a nap afternoon. Small nap, not before, not after 5 o'clock, not after 6 o'clock. That's not called a nap. That's called early sleeping or that's called sundowning. So take a nap in the afternoon after you eat something. So that's if not sleeping properly, 6 hours, minimum of 5 to 6 hours of good night sleep is very important. Especially the sleep between 12 and 5. That's where we get the most deep sleep, restful sleep. That's called REM cycle sleep. So 12 to 5 o'clock. That's the best thing you got. You really have to utilize those hours. So if I cannot sleep during the day, during the night, if I'm not getting those time, if I'm feeling tired, fatigued, take a little nap during the day. Not after 4 or 5 o'clock. And limit carbohydrates, like I said, cakes, cereals, cookies, white rice, or bread. Try to limit as much as possible. I know definitely we have to use it, but try to limit as much as possible. Try to use some other alternatives. And now next, the vitamin D levels test. I was talking about in the earlier slides about the vitamins, how much role they play. Vitamin D is one of the important vitamins that really everybody needs it for, not only for the bones, but research has said that low vitamin D for a prolonged period of time can cause memory loss. Especially in our area, Chicagoland area, in northern side of we hardly get any sunlight, right? So especially when the day is very short, mostly there is nightly hours. So try to find ways to go out or get some exposed to sunlight. It's very important. Check your vitamin D. Ask your doctors to make sure in the routine labs that we get, annual labs, tell them to include vitamin D levels check too. The earlier we get treated, that's better for us. And stop anti-inflammatory medicine like pain medicine, ibuprofen. Everybody, I've seen people popping in pills like ibuprofen or naproxen. There's over the counter, it's off the shelf. Any small simple pains, I join popping the pills. These are the anti-inflammatory. The pain medications, Tylenol is okay, but this ibuprofen, Aleve, that has research said that chronic use of those medicines can cause memory loss. And I think we're almost coming to an end. Yeah, this is the healthy eating. One thing I would like to say is this slide. Almonds, fresh almonds and fresh walnuts. Those are the best thing for the memory. Start using it in a daily routine. Yeah. The pista? Pista is not there in there. It's not included. It can help you accumulate some fat. Yeah, it's not good for you. So those are the best thing. Eat some vegetables, a lot of vegetables, the first picture. These are the main thing is almonds and walnuts are the best thing for your brain and for your healthy heart and for your body too. So try to use this as a routine, not the fried ones. Oh, I can see a lot of fried almonds and fried other things, just fresh when I'm talking about. Handful of fresh almonds or some walnuts daily, you're not going to go wrong with that one, I'll tell you that. Yes, sir.
Most of the almonds come like a little bit salty or taste.
I just told you, fresh almonds, no sir, no fried or something like that. Leave it alone, leave it aside. Yeah, the fresh almonds and walnuts, those are the best thing. No fried, nothing. Just try to avoid that. Exercise, stay active. Use your activity as much as possible. Small, light weightlifting is also very good. Just helps you with your muscle strength. Do some strengthening exercise. If somebody has some time, I can show you what can we do in just 10 minutes. Do a strengthening exercise for your hip and for your knees. I can show it to you later on. Because as we grow old, these bone joints, the muscles around these bones that holds the bones get a little loose. In the way, let the bones go and collide on each other. So the bones is nothing wrong with the bones, but the muscles around the bones that's holding these bones gap together, they get loose, tend to get very loose, and in the way that the bones on each other, they collapse on each other, cause severe arthritis. So strengthening exercise with mild exercise and everything, keep these muscles around the bones intact and very powerful. In the way, hold these bones together like this. So it prevents from arthritis too. The next thing is regular exercise, good night sleep, mind your medications. The less you take the medication, the better for us. Every medicine is a chemical. Every single medicine is a chemical. Every single medicine has its side effects. So the less we take, that's better for us. I know doctors are there to write the prescription. When you go to a doctor, they can write 3-4 prescriptions, especially in our countries. For one disease, you go there, you come out with 10 medications. So the less you take, that's better for us. And avoid smoking, of course. So have positive attitude. Is the glass half empty or half full? Always have a positive attitude. No matter what, how old I am, no matter what, where am I at. Always have a positive attitude. I can do it. I can do it. Don't take negative things and don't go sit back at your home. Try to have always involve your family members. Go to social activities. Even though my knee hurts, my back hurts, it's so cold outside. But if there's a chance, utilize it. Just keep always a positive mood. Everybody, I'm talking about the whole, addressing both the audience here. So the small verb is saying it's natural to make mistakes. Everybody to err is human, right? It's natural to make mistakes, but there's no guilt to that one. There shouldn't be no guilt to that mistake. That can turn into a small blame and act of defensiveness, and that can project onto others, right? So don't ever feel guilty about anything. And the last thing is dua is, this dua is very good Jamia dua, mashallah say. I learned this dua when the COVID started.
We can give some, question and answer.
Yeah, this is the last slide. This slide, just with the dua. Allahumma inni a'udhu min al-basri wal-jununi wal-juzami wa sayyil asqam. I would say the junun is also, I would say, include dementia in that too. Any disease would be there in there, so inshallah. So this concludes my talk. Hope I have not taken much of your time and I did not cause any brain fatigue. Thank you. Now next question is question and answers.
So, yeah, question.
What about that legislation they show on the TV, pre-version? It's so much ad comes and people say that we are taking for such and such long time and we are feeling good. What's about that?
Meditation is one of the important things that can train our brain to control ourselves. Not only physical or mental training, that's a very good thing. At least meditation for at least half an hour to 45 minutes after Fajr to sunrise. That's one of the sunnah we have, mashallah. So just try to do a meditation on yours. They're really good for the brains. Really helpful. If you cannot do it in the morning, meditations.
Organized way, I will first request sisters, but you have any question from the sister side? Yes, sister.
The question is, she wants to know what sundowning is. I'll come back together. The sundowning is a part of dementia. Usually happens in the moderate stage to severe stage. Early mild dementia, you would not see any sundowning. You might see very rarely. What happens is, as soon as the sun starts setting in the afternoon, late afternoon or early evening, the person who has dementia, they start getting jittery, very nervous, anxiety, they start wandering. So that's very, very important cause of indication for Alzheimer's dementia. It happens mostly in that one. The best way to take care of that one is distract that person from that environment. Divert them, give him something he likes or he or she likes, or involve in themselves in some activity that he or she likes, or give him a cup of coffee or milk, something like that. The distraction from that thing. Yes.
Okay, sister, any other sister?
Yes. MashaAllah. 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 The sister is saying is, the example I gave for Dr. Abdul Sattar, her mother was a paradigm for him. She was listening to her kids and other people on a regular basis. That was an example for other to follow too, mashallah. So that's a great family. I really have a good respect for the whole family.
Any other sister? I am going to the brother's side.
Yeah, I take the question from the doctor.
Everybody will get a chance, please. Yeah, go ahead. No, brother.
Go ahead. Go ahead. Up. Would you like to? No.
Yeah, the question brother is asking is if I can share these slides and everything with the senior committee. Of course, why not? It's for the beneficial of the committee. Definitely, I would love to do that. No, definitely, I would love to. I'll get the printouts and I can give you the printouts to brother or the committee here. Or if anybody wants any other presentation, I'll be happy to go other places and do the presentation too. Brother Baki.
Is it possible to get this presentation on the email or something you can send it?
Yeah, I can. That's what the brother Malhan said. I can email it to you or
Hard copy.
the soft copy, right? Yeah, I can do it. That's no problem. Inshallah.
The question was this. One of the person that I know, he had a stroke.
Mhm.
After the stroke, he came back, everything bodily, physically, he's fine. Only thing he does is he's speaking something language that you don't understand.
The question is, one of his known brother who had a stroke. After his stroke, he recovered completely. He came back to his normal activities, except for he cannot talk properly, he cannot understand properly, he cannot express himself properly, right?
He speaks some language,
Different language, yeah. The stroke affects different areas of the brain. Like some stroke affect the biryani area, some stroke affect the halim area, some stroke affect some other area. So the area that's been affected is a speech area that got a stroke in that area. So either he cannot express himself, he know what you and me are talking about, but he cannot express, or is receptive, he cannot understand what I'm saying. So he tried to answer your questions in different language. Yeah, so it's either receptive or expressive aphasia, that's what we call it as, yes. It's a part of the brain that's been affected in the speech area. There's much we can do about it. Hardly, depends on how big the damage area is. Sometimes the speech therapy can bring him back, but it won't be back to what normal he was before, to 100%. Right, sorry about that, yes.
My question is regarding, have you come across there's any research going on, the people, especially for Muslims, in the Muslim community also, those who pray regularly, because they go for Sida, at least 4 times per cycle, almost 20 times down the head. So is that helped not to get or delayed the Alzheimer's disease? So is there any research working in the Muslim communities or Muslim countries where the people perform the prayer and the non-Muslim are not performing prayer, not going down? So is there make difference if a lot of research work going on like that? They can prove that because, as you said, you exercise, but in this especially for performing prayer, you go Sida. In that you go for but good time. Brain circulation will be there. So that can prevent getting Alzheimer's.
The question from Dr. Khalil is, we as Muslims do sujood several times during the day. Is there any research going on, or is there any research has been done in the past telling us when somebody bow down in sujood, that helps him with the memory? Is that right? So, no, I didn't answer the question yet. So my answer to that question, Brother Khalil, is I would leave namaz and sujood just for the sake of namaz and sujood. I would not involve the worldly matters with that one because I'm doing it for Allah subhanahu wa ta'ala, not for worldly gains, right? So there might be different research that might have done it. They might be doing it, I'm not aware of that. But definitely improves blood circulation to the brain, it's helpful. But I'm not sure is really helpful for the memory loss or not. But I would definitely leave namaz, sujood and everything for the sake of Allah subhanahu wa ta'ala without any worldly gains.
I agree that.
Right. People ask me for,
Meditation.
right.
When you are doing the people are telling meditation, so it should be, we
So-
should encourage that.
Right. If somebody wants to do the sujood, do it after farad. Pray another 4 rakat, why not?
That is doing, but what
Right.
people regular,
Right.
people
Right.
there.
If somebody wants to do the exercise, do it on their own. Do another 4 rakat. I would not do 4 rakat extra for the sake of that one, right? I would do in the first only.
See, I'm not telling that.
Right.
But we can prove with that what is the effect of it.
We can definitely. That's a good point to do research. Yes, that's a good point. Yeah, Jazakallah khair. Right. Dr. Basharat, he's my colleague, friend, and board of director for Hayat Clinic that we run together, mashallah. So he's here, and Dr. Mubin is also here. He's a liver specialist, he's a cancer specialist. Jazakallah khair for coming. Yes, Basharat, Dr. Basharat.
Very good talk for I had a couple of questions. One, when would you start giving these medications and at what stage? And how would you monitor whether this medication is working or not? When would you stop the medication?
That's a very good and valid question. Jazakallah khair asking is, the earlier intervention is much better. The earlier onset is
prolonging the onset of moderate to severe dementia. Once we hit the moderate type, late moderate, there's nothing can be done. So early on intervention, if somebody is diagnosed with early dementia, start the medication right away. Family members goes with them, talk to the doctors, and doctor tells me after doing all those tests and everything, he has mild stage of dementia. That's where we start the medications. Low dose or a higher dose, doesn't matter. With the constant every 3 to 4 to 6 months of rechecking again with the doctor. So early intervention with those non-medical and other things that we talk about, medication, early onset of medication is also very important.
This side, brother. Yeah, I'll come to you. This brother.
That's it, doctor.
As long as for the exercise, I suggest that yoga is the best exercise every day, at least 20 minutes. Yoga is the best exercise in the book.
Yeah, the brother is suggesting yoga is the best kind of exercise, best meditation. I agree with that one. There are certain limitations to that also. Religious versus non-religious. There are certain yogas that involve non-religious and other religious practices also. We try to look into that one too. But definitely any kind of meditation does not involve any of those things. It's more encouraging, yes. Dr. Omar.
Have you any figures about the incidence of Alzheimer's in different ethnic groups in different countries, or is it the same throughout the world?
The ethnicity, which is more prevalent. I'm not aware of that honestly, which is there any particular ethnicity to any particular type of dementia, but I think it's mostly prevalent, pretty much common in most of all the ethnicities, yes. Across the board, yes. Dr. Mubin was the next. Dr. Someone asked, sir, brother.
My question is very simple. I'm wearing my glasses and looking everywhere. Is it stage of dementia?
Yeah, I saw you doing the puzzle very nice and clean. You did a good job. 100% flying colors, mashallah. No. May Allah save us from everything, from those diseases, from Juno and everything. May Allah bless you all. The senior committee, Dr. Mubin, is another question.
This brother, the last question.
If anybody has, I can ask.
I don't have any other.
No, go ahead, brother.
Quick question, like in elderly and early stages of dementia, the first sign contrary to sleep disturbance. Is it the amount of the hour of sleep matters, or is it the consistency or continuity of sleep?
The question is, one of the signs of early dementia is sleep disturbances. So he's asking whether it's consistency or amount. Any change in pattern. I'm sleeping 5 hours at night and 2-3 hours during the day. If that's my routine, does get disturbed, that's it is changing mental. If I'm sleeping 8 hours during the night, I'm not sleeping during the day, and thus changes, any change in their pattern, normal pattern. Some people, they work from 7 o'clock till 8 o'clock in the morning. They sleep during the day. So if the pattern is changed, that's where we get to get alarm about that.
Okay. Just to end.
Any other questions? Brother Muhammad has one question. He definitely he needs one.
Following Dr. Umar's question, to me the one thing that our community is very susceptible to is the overindulgence in rice and bread. And like you said, rice.
Right.
rice and
Right.
bread. So what can we do? I don't know if it's of course Alzheimer's, or definitely there's a lot of other health risks.
Right.
How do we change that?
The brother is asking about the dietary changes because the staple food for Asian people are rice and those carbohydrates. How do we change that? We got to do an early onset for that one. We cannot do it when the dementia start affecting me. I'm taking a change on my dietary habits. Not going to happen. The bus has already left the board. So try to do it at least about 10 years before I'm getting to the age of 70 or 65 or 70. That's where the more important thing, the changes happens is, it's not just 1 or 2 years of exposure to those high quantity of rice or carbohydrates, or it's over a period of few years. So about 8, 10, 12 years, try to build up the habit, try to cut down as much as possible. The best thing is, that's the way to go. Hope I answered your question.
All right, now I request Brother Atiq for a word of thanks. Please, Brother Atiq.
Jazak Allah khair. Thank you so much for coming. Appreciate that.
Assalamu alaikum. I would like to thank Dr. Farooq Ahmed for giving such a wonderful and informative talk. Mashallah, we're all going to benefit from this. Next, I'd like to thank all the audience members who are here. Without you, this program would not have been very successful as it is. Jazakallah for coming. And then I'd like to thank our chairman, Hashmi Uncle, Kulsum Auntie, for putting this program together. Plus, I'd like to thank our Hafiz, Khalil Saab, Sadiq Uncle for introduction, and all the senior members for putting this program together. So Jazakallah. And one small announcement is there is a program coming Tuesday on is stress management and healthy self-esteem. It's going to be here this Tuesday, same timing, 6 to 8 p.m. So please try to attend. This will be very beneficial. So here we have a dua next.
Okay.
Oh, there's another one.
Catches?
General body meeting tomorrow at MCC. 5 p.m.
But tomorrow? Okay. Hold
5
on.
p.m.
Hold on.
I'm sorry.
Yeah, okay.
5 p.m.
Why don't you announce? I will do. Yeah.
Yes, our MCC's annual general body meeting is at MCC Elston, 5 p.m. Inshallah, so please try to attend.
Thank you, brother. I think I would like to say again that on behalf of the committee, to thank Dr. Dr. Farooq. And then, in addition to that, I have a request from all brothers and sisters. This program we are trying to organize and present to the people as nice as possible. In this one, we need your help, some support in this arrangement. So I request all the sisters and brothers, please donate. We are not asking a lot of money. Whatever little you could put, and that money will be used in the organization of this program. So I expect every one of you will put something, and I think there is a box either at the entrance or someplace. So I humbly request, please do that. And then finally, I request our Brother Rashid to make dua for this program, so that we should get some information and use. But this program, I will say, was very, very informative and helpful for us. And yeah, this brother is getting the box. Please. Okay.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Alhamdulillahi rabbil alameen wa salatu wa salamu ala sayyidil mursaleen. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار قنا عذاب الحشر قنا عذاب القبر قنا عذاب الدارين اللهم أنت سلام منك سلام حينا ربنا بالسلام وادخلنا دار السلام تباركت ربنا تعاليت يا ذا الجلال والإكرام اللهم اهدنا الصراط المستقيم اللهم أيد الإسلام والمسلمين اللهم اغفر للمؤمنين والمؤمنات الأحياء من الأموات لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. I pray to Allah subhanahu wa ta'ala to bless this gathering, and I pray to Allah subhanahu wa ta'ala to bless our brothers and sisters with excellent health, joy, happiness, prosperity and long lives. And may Allah subhanahu wa ta'ala grant them the best in this life and the best in the hereafter. Allahumma anna ala zikrika wa shukrika wa husni ibadatik. Sallallahu ta'ala ala khair khalidi Muhammadin wa ala alihi wa sahbihi ajma'in. Birahmatika ya rahman rahimin. अल्हम्दुलिल्लाहि रब्बिल आलमीन। अस्सलामु अलैकुम रहमतुल्लाहि बरकातुहू।